Braxton Hicks versus true contractions. What's going on in your uterus? Meet your uterus. More importantly, meet your cervix. Though yours is probably a lot less latexy, this is what it should look like when you're not in labor. It's long, it's thick, and it's closed. And that's how we really want it to stay until you're closer to term and ready to have your baby. Contractions are kind of like an alarm clock telling your uterus that it's time to have the baby. And sometimes that alarm clock goes off a little bit early, and that's when we get Braxton Hicks. They squeeze your uterus from the sides. It feels like a tightening to you. But even though there's things happening with your uterus, they are not effective. Your cervix is still long, it's still closed, and it's still thick. Nothing's really happening. Now, Braxton Hicks differs from true labor contractions because true labor starts when oxytocin's released into the bloodstream. And that oxytocin causes our uterus to contract from the top down in these big, efficient contractions that brings baby's head down onto the cervix. And with every contraction, you can see that that cervix is thinning and that cervix is dilating. And this continues to happen more intensely and closer together until we have a baby. So if you're wondering, are these Braxton Hicks or are these true labor contractions and I should get my hospital bag by the door, here's some things to consider. If the contractions don't follow a regular contraction pattern or they go away with things like position changes or hydration or emptying your bladder or rest, they're very likely Braxton Hicks. If the contraction pattern is nice and regular, and even more so if that contraction interval is getting shorter and shorter as time is going on and you can't shake them no matter what you do, it's probably the real thing. People always ask me, when should I go to the hospital? This one, super specific person to person, so it's best to have this conversation with your provider ahead of time. It's going to depend on which pregnancy it is, if you've had a baby before and how quickly that delivery was, how far away you live, if you're high risk or low risk, lots of things to take into consideration. For myself, I personally followed the 5-1-1 rule. If my contractions were 5 minutes apart and they were lasting 1 minute each and it was happening for an hour or more, I went to get checked out.